Okay, and now it's recording.
Jeez.
Perfect. Okay. All right. Hi, everyone. Welcome for another year. I'm glad to be back. We're going to do some quick introductions. We do have a couple of newer folks to our meeting, and we also have Daniela, who's now our new hub program coordinator. And she'll be talking at the end after introductions, just so that everybody knows who she is and what she's going to be doing. We are excited to have her. I'm excited to have her since, you know, Margaret jumped ship. Sorry, Margaret. Now I'm all alone. But at least I get to work with all of you still, and I still get to work with Margaret. So that's fantastic. It's always nice to work with people that we've worked with in the past. So if you don't mind just introducing yourselves and also putting into the
seriously, Giovanna?
Who's that? So you're gonna introduce yourselves, everyone. If those that don't have a video on them, if you don't want to show face, that's totally fine. You could still just introduce yourself. But then also, please make sure you put your name and your affiliation in the group chat, please, for minute purposes. Thank you. We'll start with Kathy.
I was just about to enter my info in the chat. I'm Kathy Hazlett. I'm with Positive Directions and the Coalition Coordinator for Fairfield Cares.
Hi, Terry. Can you introduce yourself?
Hi, I'm Terry Drew. I'm the Director of Youth Services for the City of Stamford. And welcome back, Giovanna.
Thank you. Hi, Kristen.
Hi, Giovanna. It's so awesome to see you. Welcome back.
Thank you.
I'm glad you have a new partner in preventing crime.
Yes.
I'm, excuse me, Kristen McCarthy-Vahey, and I co-chair Fairfield Cares Community Coalition. And I also will just share my other hat, which is a state rep in Fairfield. So just from a planning prevention standpoint, keep me in mind that way too.
Thank you. Ellen.
Hi, I'm Ellen Brzezowski from Greenwich Together Kids in Crisis.
Danielle, I'll save you for last, okay? Because you were up next. Hi, Melissa. Morning.
Hi, I'm Melissa McGarry, Trumbull Public Schools, TPOD, Trumbull's Prevention Partnership.
Georgette. Good morning.
Good morning. Thanks for having me here. First time.
Yes. Please tell me where are you from?
I'm from the Child Guidance Center of Southern Connecticut, but right now I'm attending on Shelley's behalf. I'm the co-chair for the Thriving Youth Task Force.
Which youth?
Thriving Youth Task Force in Darien.
Ah, oh, nice to meet you. Wonderful.
Nice to meet you too.
Thank you for coming. Emily.
Hi everyone, I'm Emily with Georgette with the Thriving Youth Task Force in Darien.
Jessica. Hi.
Hi, Giovanna. Hi, everyone. So I'm Francesca from Bridgeport, working at GBAP. And I think that's pretty much it. I did want to not to take your job or anything, but I did want to say that I do have Ariana who's here because I have to report out on planning council at 12. So I'm going to come off so that she can continue and take notes because Lisa could not make it.
Okay, thank you.
Yeah, so she's on here somewhere.
Everyone doing well at the office?
Everyone's doing well. Yes.
Good.
Yeah,
Good,
it's good to have you back.
Yes, nice to be back.
Awesome.
Hi, Wendy.
Whoops, you didn't hear that. Hi, I'm Wendy Benevegna from Fairfield Cares Community Coalition with Kristen and Kathy.
What's going on? Do you have a boo-boo?
I had shoulder surgery the end of August, and I'm out of the sling, but now I'm icing because out of the sling makes it a little more difficult.
Oh no. Well, I hope everything is okay and you have a speedy recovery.
Thank you. Just get a little cranky. All good.
I hear you. A lack of sleep can make me cranky too.
Well, yeah, that's exactly where I am, but for different reasons.
Yeah.
Yours is a cuter reason.
Yeah, thanks. Genevieve, hi.
Hi, I'm Genevieve Eason. I'm with Wilton Youth Council.
Ariana. I believe Francesca.
I'm going to chime in first. She said she sent it in the chat that her microphone is not working, but I did kind of already introduce her.
Yes, you did.
Yeah, but she mentioned her microphone is not working.
Okay.
Yep.
Let me see. Did I miss anyone? Margaret. I forgot Margaret. I think she went bye-bye.
Yeah, I think her phone rang earlier, so she stepped away.
Oh, that was her phone. Okay.
Yeah.
And then me, Giovanna, I'm the brand newbie. I'm Stacy Walker. And
Stacey, I don't see you anymore.
You can't see me? Oh, I'm here.
Oh, you were, oh, now I see you.
So I can't even I need to put my name in there, but I'm still Zoom learning. I am at New Canaan Cares. I've been there for 3 years, so had the pleasure to be with Ellen when she was there. And I do the programming for New Canaan Cares, and I just picked up the New Canaan to run our coalition, the New Canaan Coalition. So I'm brand new and learning as I go.
Wonderful. Thank you for attending.
Thank you for having me.
We're glad to have you here.
Thank you.
Margaret, you back?
I'm back. Sorry about that. So I'm Margaret Watt. I'm with Positive Directions. So we work with Fairfield, Westport, and Norwalk coalitions, and I'm here today for the Westport Prevention Coalition and Norwalk. Just as an announcement to everyone, over the summer we merged. There were really 2 small prevention coalitions in town. There was one that was funded through the PFS grant, which has ended, but now Positive Directions got the Drug-Free Communities grant. And then separately, Human Services Council was the LPC for the town. And that's Diamond Seed, who is going to try to join us today. But we merged the 2 coalitions into one, and it's now called the Norwalk Partnership. And I'm sorry I jumped off the call, and I'm just going to go ahead and share because this is what's going through my brain right now. I saw a phone call come in from the assistant principal, and my son was caught vaping in the school bathroom. So, you know, and now that I'm running the drug-free community grant for the same city where he just got caught, that's really extra special. So
I'm sorry.
I'm going to have a little emotional reaction here. So that's where I am right now.
Don't worry, Margaret, I've been there.
Thanks, Terry.
This too shall pass.
We've all been there, Margaret. We've all been there.
We've all been there, Margaret.
I know Melissa's like me too. I know.
You're in good company.
Yeah.
Well, but this also happened a year ago, and we've like been so on it, and it seemed like it was over. So I'm just like, oh my God. Anyway.
It's so painful.
Ugh.
Sorry.
It's a process. It's a process.
Mm-hmm. I can't wait for those days.
Yeah. Well, we were talking yesterday. Mateo already is addicted to breast milk. So
Yes, he is. Yes, he is. God, I love him. All righty. And last but not least, Daniela.
Everyone. So as Giovanna said, I am the program coordinator for the hub. I will oversee 7 of the 14 towns, so Greenwich, Stamford, Norwalk, New Canaan, Darien, Weston, and Wilton. I just started on Monday, but I am super excited. I've been learning a lot. Giovanna has been great. She's been giving me so much information. I previously graduated from Sacred Heart's Master of Public Health program in May. And before that, I was working at Planned Parenthood for the last 3 years. I completed 2 internships with them, and my most recent one was actually focused on the expansion of primary care, and that included mental health. So I looked for resources for all the Planned Parenthood locations throughout the state and in Rhode Island. So yeah, so I'm pretty excited.
Thank you. Kristen, do you have your hand up? That's what that is. Awesome. I'm too new at Zoom. Okay. I see chats. I see somebody trying to get into the room. So I'm trying to multitask here. I should be really good at it, right? Next on the agenda is the LPC 2021 applications. Everyone that is here today was granted another year of the LPC status for your town. We have sent out all of the checks already, so you should have received them. The checks were mailed to whatever address you had on the front page of your application. If you did not get your check yet, please send me an email and I'll try to figure out where was it sent. I sent over an email probably about a week, maybe 2 weeks ago on coalition meeting dates and times. It's our contact list that I need to update to send off to Demas, but then also put on our agenda. I know a couple of you responded, but I just wanted to know, Daniela, do you have that up that you can pull it up quickly? I sent it to you, but I didn't pull it up. I'll stop sharing so you can share.
Okay.
I just want to make sure that everything is correct because I know some folks have already a permanent Zoom identification. Some others don't. They wait until days before their meeting to put that information into those that RSVP'd. So really quick for Bridgeport, just want to make sure I'm going to go through this as quick as possible, and please let us know what needs to be updated as Daniela is going to update this information. Bridgeport, second Tuesday, 10 to 11:30.
That's correct.
Okay, do you have a standard Zoom identification, or do you send it out when you send out your agenda?
Yeah, it gets sent out with the agenda.
Okay, Daniela, you could just update that RSVP to receive the Zoom information. Darien, you already told me third Thursday, 8 to 9:30, correct?
So sorry, I was muted. It's the third Thursday of every other month, but I sent you the dates, so you've got them.
Yes, I will double check that email again, okay? Easton, we can skip. Fairfield Cares, third Wednesday, 8:30 to 10.
Yep, and we have a Zoom. Also, can you add Kathy to our contact as well?
Absolutely. Kristen, I also have Wendy, Phil, and Rainey. Are those folks okay to still email as well?
Yep. And we have, Daniela, I'm gonna get you we have a Zoom link that's on every publicly noticed agenda that we use, but I'm gonna try and drop that in the chat for you so you have it too.
Perfect, thank you. And then over, Daniela, go back up to the contact and write in Kathy Hazlitt with a C. How did I know you were going to do a K? Hazlett. Greenwich, I know, Alan, you sent me something.
Yeah. So
You
yeah, I
sent me
can
the
be added.
dates. I have that email. You don't have to, I'll look at that email.
Okay, yeah, we have 6 meetings a year. You know, we're doing it through Zoom now. We're hoping at some point to get back to in person. So we don't send out Zoom links until we send out the agenda.
Thank you.
Okay.
We can skip over Monroe. New Canaan.
Sorry, just gonna mute myself. Yeah, so for contact, you could put me, Stacy Walker, and that's with an E. And you can, if you would kindly please add my email as well. It could still go to CARES ED, but my email is swalker@newcanaancares.org. Okay, and then for meetings, we do quarterly meetings, and they're the second Tuesday of the month, and the Zoom link goes out that morning with the agenda. Do you want me to give you the dates, Daniela?
Sure.
So it's October 13th, then January 12th, April 13th, and July 13th.
And you can take out Jackie's email above.
So I have a question. If we add more meetings in, do I need to report that to you guys?
It would be nice because we do put it on our hub calendar for everyone to see. So a lot of times, because we're a resource to the region, they'll go on our calendar and say they're looking for a prevention meeting in their town of New Canaan. It will be on our calendar, and they could reach out to you and get that get more information.
Okay, great. I'll do that for sure.
So Norwalk is now, the name has changed to the partnership.
The Norwalk Partnership.
Norwalk Partnership.
Yeah,
Sorry.
Actually with the is even a capital because the website is the Norwalk Partnership. .org. And Danielle, I just actually threw the info in an email to you or in a chat. So yeah, just change the name in that column and the third column, and please add me to the contact with Diamond. We have a new website, but it's not published yet. We've got it and we're working on it. We do have social media, Facebook and Instagram at Norwalk Partnership. Those are brand new. And I put those in the chat.
Okay, great.
And but the date is last Wednesday of the month from 2 to 3:30.
Terry, is everything the same for you?
So we changed it up a bit. I'm just texting now. We had a meeting like 2 weeks ago, I want to say, in September, and our next one is November 16th. So I'm just texting to see. I'm not sure if we decided to do every other month. And then for the list, LPC, and then we also have the vaping task force, which is meeting separately, and then reporting out at the monthly or bi-monthly meetings.
Wonderful. The vaping task force is specifically to Stamford, or
Yeah.
is it the surrounding towns as well?
No, right now it's specifically to Stamford, and we're working directly with Stamford Public Schools.
Okay.
And the kids have developed a whole curriculum that we're going to be using in our health curriculum.
Wonderful. Any way possible to give us a little update on that vaping task force for those that we're all working on that initiative for this fiscal year?
Yeah, so we partnered with Liberation with Ingrid, and then we partnered with the Mayor's Youth Leadership Council in the schools. There's a chapter in each high school, and the kids have been doing a lot of research on curriculum and what's working and what's not working. And they're developing a whole list of resources and then a whole curriculum that we're going to be using in the health classes for the schools.
Okay.
It'll probably be done virtually for now because they're on a hybrid model, and then we'll reevaluate in January.
Margaret, a month or so ago when we had that intern working for the hub, she created a resource document. I hope that you're using that so that you don't have to do all of that work again.
Yep, they
Perfect. Great, good. And everyone knows about that, right? How the intern created a resource document for prevention, curriculum, and intervention programs that are in our area or around the state.
Was that
They
email?
were, yeah, it was actually like the published curricula for all related to vaping. So prevention, intervention, and sort of recovery.
It's a
that
really
went
good
out
document.
at the end of July.
Yeah, it's really good and it's very extensive.
Can I ask a favor? Can someone email that to me if someone has it? Because I just took over this LPC just recently, so I don't know. I don't have all that. I don't believe I was on any email chains for that stuff if you guys sent it out, but it sounds like
it went to it did go to New Canaan Cares email, but we definitely can send that out to you again.
Awesome. It probably went to our old our acting ED, so I don't have any of those, so it'd be awesome. Thank you.
Margaret, do you want to just talk about what the intern did and the good work that she put out for the short period of time that she was with us?
She was great. That was in July, and I want to give her kudos and also I guess that reflects well on Wilton Public Schools because she had graduated there last year and she was a freshman, had finished freshman year at Colgate. Her name is Olivia Borden, and she did 2 products for us. I worked with her in July, sent them out toward the end of July, so you can probably find them in your email. But one was that, and so that document is maybe 4 or 5 pages long. It's just a comparison table. So the first part of the table is vaping prevention curricula. The second one is intervention. Third one is like, treatment recovery kinds of curricula. But it was really designed to be as helpful to everyone as possible going into this year where we knew all the LPCs had to do vaping. So you can look at, is the program evidence-based? Is it free? Is it aimed at parents or teachers? What kind of training do you have to do to deliver the program? Is there a cost? How many hours of curriculum is it? So that's one product. The other product she did for us that we also sent out was a review of all the Board of Eds in our region, the 14 towns, their ATOD policies. And I think what that's really useful to make sure your boards of ed have seen if there's a policy committee. I see Ellen asking if they're on the hub website. I think they were supposed to be, but I don't know where they are, and I'm sure they can be sent out again. So she went to all the Board of Ed websites, downloaded their policies. We worked together on kind of like a set of criteria. And so what you can look at when you get that document is there's literally a list of things that could be in an alcohol, tobacco, or other drugs policy. And you can literally see, like, does my school district have that component or not? So like really, what's missing, what could be there. There's some sample language sort of toward the end. And at the beginning, I asked her to kind of put together her observations after she went through these things in really great detail. And she was really insightful. And one of the points she made that I think is worth highlighting is she said all the districts basically said that, they were restorative and supportive and whatever, but then the policies as written were much more punitive. And the other thing I know she and I talked about and wanted to highlight was many districts had policies that were relatively specific, and some had these like blanket, if a kid is caught with whatever, any or all of the following could apply. And so what's relevant there is that opens itself up to all kinds of equity issues, right? Where like, which kids have all of that thrown at them and which kids have some, instead of being really explicit, first time this, second time that. So Melissa, do you want to comment on, I know like the reason I had the intern do that was you bringing up the fact that that there was a statewide recommendation for ATOD policies to be maybe looked at by school districts. So we were like, how much information can we give them to make it easy for them, right? It was around medical marijuana or kratom or something, right?
Yeah, I think CBD is what kind of prompted the state's Board of Education. They were recommending school boards to devise a CBD policy. So I was approached by our board for my input, and that kind of sparked this conversation of like, okay, who's got policies? What do they look like? And how do they compare to others in the region? So it was wonderful to have this intern do all the legwork, and she did a beautiful job.
And so I think we sent that policy document out to all the LPCs, but also all the superintendents in the region, but there were a lot of superintendent turnover this summer, right? So I think the thing it's just maybe a good time to cycle back. And if they're gonna look at CBD, creating a CBD policy, that means their policy committee has to meet. So it's just an opportunity to go look more broadly at all of this, right? We made it easy for them.
I actually just found the email and I'm going to forward it to all of you right now. Has anybody worked on policies with their BOE since this email? Anyone?
Giovanna, we at least have raised the issue with our superintendent, and I forwarded the email to the head of our policy committee, but I told her I wasn't going to touch it with her until the election was over. I also, just from a policy, speaking of policy, Terry in particular, I was trying to fire up my state computer while I'm sitting here because the Cancer Society, Lung Association, and Heart Association are interested in doing local ordinances on the flavor ban. We were poised to ban flavors in the last legislative session, and we were not able to. So speaking of policy and environmental kinds of impact, we are hopeful. I mean, I'm hopeful that whoever's in the next legislature will take this up, but if there are municipalities, cities, towns that are interested, and Terry, your group seems like one. I don't know if you're interested, but I'd love to connect you with them.
If you can send me the information, then I can present it to the kids at the next meeting. That'd be great.
I'll connect you with Ruth Kenovi from the Lung Association, and you two can talk about it directly.
Perfect.
Kristen, I love that information as well. So if you could send, it's Ellen from Greenwich. So that would be great. Thanks.
Giovanna, Antonio just got back to me. We're doing the fourth Monday of every month from, it's 12, and it's a Zoom.
Perfect.
And we're using the same Zoom address every time.
Okay. Can you just put your Zoom information into the chat for me, please? I don't think I get your emails. So if everyone can, for those towns that I didn't work with in the past, if you can just add me onto your emails as well. Most likely will not be attending unless Daniela is out for whatever reason. But just to keep me in the loop as well would be great.
So Giovanna, I have a pretty large distribution list. Do you want me to put you on that? It's a lot. It's very informational. Margaret, you can attest to that.
Yeah, you see me nodding. It's a great list.
Sure.
Okay, you'll get.
I already have 500 emails I got to deal with. Sure, what's another 10?
Perfect.
Watch those Friday afternoons, Giovanna.
It starts around 3.
Terry.
Oh, geez. Even on a Friday too? So if anyone is doing anything, and if Danielle, for minute purposes, if you don't mind just putting at the end of the minutes how Kristen's gonna send out the contact information to Terry and Ellen.
Okay.
Stratford is not here, but their information is still the same. Trumbull, Melissa.
It's not always the third Wednesdays, but you should have gotten the list on our meeting notice yesterday of our expected dates for the school year. It just depends where school breaks land.
Perfect. Daniela, just write check email and I'll look at that. I haven't looked at that email yet.
Yeah, and our Zoom goes out the week of the meeting with the link. And if you could add Kirsten in addition to me, that would be great.
Yes, you can write Kirsten and
K-I-E-R-S-T-E-N. Naumann, N-A-U-M-A-N-N. And I think she's here. She should be on this meeting.
I think I did see her come in.
I'm here.
Hi, Kirsten.
Hi.
Weston is not here, so we'll have to skip over them. Westport.
Yeah, Westport. The name of the coalition, the second column is Westport Prevention Coalition. And it's really basically a program under Westport Together, or a committee or something, but yeah, that's the name of it. And for social media, I think it would be listing or additionally listing Westport Together's social media, because both list please keep Positive Directions and also add Westport Together's social media. They have an Instagram and a Facebook.
We can look at that later on, okay? Just put the Westport Together.
And in terms of meetings, the meetings are going to be, we've just had one and we have the next one. They're going to be the first Tuesday of the month, but they want to experiment with changing the times, like sort of swapping between like earlier in the day and later in the day to kind of capture different people.
And just under where it says the zip code, putting Margaret's email address over there.
Thanks, yeah.
mwa@positivedirections.org. And Genevieve, I know that you said meetings are in discussion now, right?
Correct. Yeah, we're working on it.
I do want to just give kudos to Genevieve and her team of folks in the not only great work that you are doing right now, but dealing with 3 sudden deaths in your town is unimaginable. And I just want to let you know that yesterday at the CT SAB state meeting, your team was mentioned, and how good of the response that you have been given and the work that you guys have been doing. They see it and they are really happy with the postvention strategies that you guys all have worked on and tried to implement in your town.
Thank you, Giovanna. I'm going to pass that on to Kim Zemo, who really gets the credit for how well the schools in our community have handled the response. She has really, really worked hard. So she gets the credit for that, and I will let her know. Thank you.
Yes, please. Okay. Daniela, you can stop sharing, please. Okay, I did have a couple of questions in regards to changes in work plan. So at any point in time, you have a change in your work plan, whether it be in your work plan or budget, what I'd like everyone to do is send me an amendment, letting me know what that change is, okay? And really, the reason why I'm asking for it is because when I put stuff into impact, I'm putting stuff in that I received from your application. So if I do need to make a change, I have to go all the way back to the beginning to then move forward. So the sooner the better I know the change, the easier my life will be. I already sent everyone due date reminders. If you don't receive calendar invites, I also sent an email with dates that we will be meeting or demographic forum dates. So demographic forums are going to be submitted December 15th and April 15th, okay? So anything from the time of the contract, September 1st to December 14th. If you did any activity under the LPC status, i.e. using LPC dollars, then you want to have that demographic form submitted to us, okay? Same thing for April 15th. Anything from December 15th to April 14th, you want to submit that stuff. And then at the end, of course, whatever final demographic forms you have and final report, you're going to submit on July 31st. We are going to...
I might have missed this, but it can go to you, because I think I kind of used to send them to Ray, and so it's for you.
Yes, everything is going to be sent to me. Unfortunately, Ray is no longer with us.
Right.
So everything will go to me for now.
Got it.
Mm-hmm.
Got it. Thank you.
And then we're going to have a mid-year check-in. I already put a date down for January 29 from 10 to 11. And it'll be a quick Zoom call just to see how everybody is doing and if there's any questions or concerns with the contract and the finishing of our fiscal year. Any questions on that? So since I've been back, well, I shouldn't say since I've been back, but when Margaret and I were going through the priority report process, we found that there wasn't a lot of data when it came to the local grassroots level, in the sense of we couldn't compare the data amongst the towns, which we were not struggling, but we would love to have that type of data when we're trying to do a priority report, and being able to compare not only with different towns, but then we can compile that information and make a really good report, a regional report, telling the true story of what Region 1 looks like. So coming back, I've been talking with our state about how can we have these Common Core questions so that you all can be able to implement that into your school surveys. I know that Emily from Darien and Greenwich are working together. They have agreed on a set of Common Core questions that they are going to be using. I know Trumbull also has questions around vaping, and they do coincide with the DFC grant requirements. So I have Emily, she's going to talk a little bit about her school survey and those Common Core questions with the addition of vaping questions. So I'll let her talk about that.
Hi, everyone. Sorry, I just turned my camera off because I'm grabbing a little bite of lunch. So forgive me for that.
Sorry, wrong timing.
No, that's fine. So what I did this morning is I just went through the survey that Darien and Greenwich's are very similar, and just highlighted all the vaping questions. So I could just shoot that to everyone in an email right now if it'd be helpful, rather than me kind of talking through each of them. But for most of the questions, the addition was just in prior years, we've been asking about alcohol, marijuana, prescription drugs. And so it was just simply adding vaping, Juul, e-cigarettes to those 4 core measures, questions that are required for most state and federal grants. And then we just added a few other ones about what students are vaping, whether it's marijuana, nicotine, just trying to drill down a little more into those areas. So I can just shoot that to everyone in an email right now. And yeah, of course, probably like some of you, we are just dying for a meeting with our superintendent to figure out the timeline and if we can implement our survey this school year. And we've got some radio silence at the moment. So hopefully we can actually get this done this school year.
Superintendents are so hard to nail down right now, aren't they?
I know that, Melissa sent over her questions, her vaping questions as well, and I'm going to send that out to everyone. What I'm hoping is, I know that this year is pretty much a wash, right? We're not surveying, and if you are surveying, you're doing a short sample, because if you are a DFC, a drug-free community, you have to do a survey under their contract. So I don't foresee us taking, if we do take this data, we're not going to be putting it toward any of our work that we're going to be doing. Right, the data is going to be really skewed because of that, because of what's happening, right? COVID's happening. Melissa, can you talk a little bit about your vaping questions? And
Sure. I mean, similar to what Emily said, I mean, we are a DFC coalition, so we already survey every 2 years. We survey all our students in grades 7 to 12. So what we did is we work with, and we do our own survey, so we're not using kind of a boxed survey from someone else. So we worked with our evaluator, Nina Chanana, and we just mirrored the questions. I think to Emily's point, vaping's a little bit of a challenge because you want to know about vaping nicotine and you also want to know about vaping THC, which is separate from probably your marijuana question. The challenge really is, like, from the federal perspective, is they don't see vaping as a substance, they see it as a delivery method. So we had to kind of, so we just tried to mirror, we just added it just as Emily stated. So you'll see that, and I imagine they look very similar to what Darien and Greenwich are doing.
for those that are that do survey their youth and parents, is this something that you would be open to add on or change your questions so that we're all asking the same questions? I spoke to the state already, and they said that they were in the process of doing, making up some questions that are related to DFC, but I'm not going to hold my breath. So sometimes we just have to kind of do what we need to do and move forward, and eventually the state will catch up with us. So is this something that everybody is willing to agree upon? Of course, I know that you need to go back to your coalitions and you need to get the okay, but I'm really hoping that this year, and the next time you do survey, that full survey, we'll be able to have those questions all the same and ask the same.
Giovanna, one question would be for those of us who have already been asking vaping questions, we also really need to talk to our evaluators, because we don't want to lose our comparison data over time by changing our questions in a significant way.
What I'm hoping is once I really review your questions and Emily's questions, I'm hoping that we can keep those questions and kind of adapt to what you've already been doing. And I've been talking to Nina as well on the side, trying to see, because I've been in 2 or 3 of meetings with her, and the same thing she brings up is about the comparison data. And I think that we need to start moving forward and hopefully be able to have those same questions asked to the community at large. So hopefully. Kristen.
And can I just say that once you come up with or adopt the questions that Melissa and Emily, can you just give them to the state and say they should just use them all over the state? I'm being serious. I'm not being cheeky. I think that we should do that.
No, what's really funny is that I sent an email to Margaret this morning, and the state was asking for those questions.
And Giovanna and Nina and I are all like, you've got to be kidding me, because we've been asking, Giovanna and I were asking the state to put together a data bank of vaping questions that would be statewide since last spring. And so that's why, you know, yes, you're right, Kristen.
So why don't you let me help with that too? Once, you know what I mean? Like let me be, you take your channel and I'll take mine, and hopefully we can somehow get there one way or the other.
That would be wonderful. I think this is definitely something that we all need to be working toward. Anybody else's thoughts, opinions?
Emily, you go first, but I want to say something else too.
Oh no. Just a super quick question from Darianne, something Shelley, Georgette's co-chair, and I were talking about was we're working on a one-pager to kind of approach our superintendent and share, this is an unusual year. Darianne is committed to surveying. It's probably more of a matter of timeline. I know Greenwich is surveying this year. Are there any other communities we could reference to kind of build the case? So
Fairfield, Westport, and Norwalk are all surveying.
Okay.
And that's actually,
yeah.
Sorry.
I was going to say Stratford's not on here, but I think they have to survey this year for their DFC.
Yes.
Okay. Fairfield, Westport, Norwalk, Stratford, and Greenwich. Okay, that's super helpful. Thank you.
And Emily, we're sending out our parent survey next week. So they are letting us send out the parent survey too, which was huge because they kept putting it off because of COVID. But now I think they're on board. So
wonderful.
Can I clarify? Fairfield is planning to. We have to get Board of Ed permission as usual, but also our superintendent is currently co-chairing the coalition and is actively engaged. So you might suggest to your superintendent to reach out to Mike Cummings in Fairfield if they have questions and you know why it's important to get involved.
Yes.
In some level.
Wow, what an amazing idea. Thank you so much for that.
And if you
I wanted to add something. Okay.
No, go ahead, Margaret.
Okay, so what I want to add about the Fairfield, Westport, Norwalk schools, which is completely confirmed for Fairfield, and the other two are sort of underway, but what we're looking at is not using the Search Institute A&B survey, but the new developmental relationship survey. So just for anyone who doesn't know about that, I just want to mention why we've been having conversations in those three towns and with Nina and Emily, who are two of the evaluators, and why we're looking at that survey. So it's new. It just came out, but they have pilot tested it, and they have good evidence that it works. The developmental relationship survey is different from their previous developmental assets focus. It's sort of simpler, and it's aligned with the CASEL standards, which so for all the schools that are doing social emotional learning initiatives, the schools will get data related to their SEL standards. So that's a plus for them. It's not looking at 40 developmental assets. It's looking at 5 types. The developmental relationships fall into 5 buckets. So there's fewer questions. So it's shorter and it's cheaper. You buy like the modules that you want. So the basic developmental relationships module is relatively small and quick. You can add on the 4 core measures that you would need for DFC and for your substance use stuff. This year, because it's a new survey and because it is this crazy COVID year, there are 2 free modules that come with it that are going to feel really relevant to the students, because one module is mental health and COVID, and the other one is around social justice issues. And it's also going to be available in Spanish as of January. So one discussion that we were having with our evaluators over the summer was, if we were going to do the A and B survey, which in a couple of towns that was the plan, it's like 160, 180 questions. And we were thinking we're trying to do them all around the beginning of February, by which time it's very possible that no one will be in school and everyone will be at home. And so I know Nina was like, kids are just not going to do it. That's too long. But this survey is very much shorter and more modular and touches on things that I think are going to feel really personal and interesting to them. And so when we talked about it with Superintendent Cummings in Fairfield the other day, Kristen wasn't, and Kathy, right? He pretty much was like, let's do it. That sounds totally like what we need. So wanted to let you guys know about that. And it is cheaper. So then I'm thinking we put some of the money we had set aside for the full A and B survey into some of the online trainings that Search has. They have 3 separate trainings related to the developmental relationships model. So.
Margaret, how does that affect though communities who have done the developmental survey before?
How can they compare?
Right. So that's where so the core measures would compare, but that's where if you've done the DA survey like for a long time, or if you're using them. So Fairfield has been administering the A and B survey, but they really haven't done that much with all the developmental asset stuff. So I think everyone was kind of like, it's okay to kind of lose that, and because we're going to gain other stuff. Okay. Norwalk only did A and B once ever and didn't manage to really get the results out to the community. And so we're okay with having like a new baseline that feels really relevant to today. And Westport was in the process. They didn't use Search before. They're getting rid of they were doing an independent evaluator. So for our communities that worked out, but that's really a consideration for others. Really.
Thank you.
And Emily, if you want me to come up with, or at least write a letter to all of the superintendents, and this goes for everyone, if you want me to write up a letter in regards to what you're doing, showing my support, and to all of them, I will do that as well. So we can definitely talk about that and what is it that you're really requesting of them, so that we're on the same page and using the same lingo.
That sounds great. Thank you.
Daniela, if you can just put that as something for me to do. Okay. Margaret already talked about BOE's ATOD policies. Let's talk about the Vaping Initiative. Say that again.
Yeah, sorry, I had forgotten it was on there separately.
Yeah, it's okay. The Vaping Initiative. So a couple of months ago, right before I think I left, Margaret, Kathy reached out to us at the hub, Kathy Hazlitt, reached out to us about a vaping initiative for our region, and every one of you agreed that you wanted to do something along that initiative. There was a town in Massachusetts, if I'm not mistaken, and you all received that article and email from Margaret. If you need me to send it out again, I will. Just let me know. But this initiative, a small chain store stopped selling any nicotine vaping product, and Kathy saw that article and thought, why not have a regional vaping initiative? So I just wanted to see next steps. What are we going to do? How are we going to do it? And get people's thoughts. And Kathy, if you want to jump in to talk a little bit more about that initiative and that article.
Yeah, it was actually Hannaford's grocery store.
Northern New England.
Which is like a Stop and Shop. It's a major grocery chain in Northern New England. And it was the coalitions in Vermont focused on where I used to work, focused on trying to convince them not to sell tobacco products, and they succeeded. So I saw that, and that was a way of engaging their youth on a substantive initiative, so fewer tobacco products are even seen in the community. So I thought, oh, maybe that's something that we can do here in Connecticut as well. And interestingly, I happened to be at Stop and Shop yesterday and noticed, at least in the Fairfield store, that all the tobacco products are behind in their customer service area, which is good. So they're not at the cash register, and there weren't too many of them. So maybe it's just going that one extra step to say, hey, do you really need to have them there at all? The other possibility is looking at pharmacies, and obviously CVS is the one that has really taken the lead and doesn't sell any tobacco products. I believe Rite Aid still might. I'm not sure about that. I know they have a smoking cessation program.
Fairfield Rite Aid, I believe, stopped selling any nicotine vaping product. Kristen, can you confirm that?
I think Wendy might have to confirm, but we actually had someone from Rite Aid who was participating regularly in the coalition as well.
Right.
I think you're right, but I can't.
Yeah.
Right now, my brain.
I could have sworn this is going back to when we were attending, having meetings in person. I believe she said that she personally stopped doing that. So I don't think that was any other Rite Aid. I think it was just Fairfield though, but I could be mistaken.
And look at it, there's Walgreens and Walmart or other places. If those stores exist in your communities, those would be other possible targets for an initiative, just to raise the awareness and let the manager of those stores know that this is something that matters in our community, and it matters to our youth as well. So. We have our first youth committee meeting on the 19th, and we'll bring it up as something that we might look into. But I just thought it might be sort of an easy initiative that we could all do within our region.
Mm-hmm. Daniela, if you don't mind just putting the survey link into our chat.
Okay.
Just a quick survey in regards to a couple of the questions that I am going to ask. We're doing this so that then we have the information from all of you in where are the youth buying, where are your youth buying tobacco and vape products? So I think that that's our first initial conversation now is who do we want? Do we want to target just one entity? Is that a Walmart? Is that a Walgreens? Is it a Shell gas station? Any type of gas station? Where are our youth going to most and purchasing? And please don't say Amazon. I know.
Daniela, the survey link came to me, but it says it's private. So in case it didn't go to anyone else, I want to let you know that.
Yes, I just saw. I resent it. Thank you.
Like, you want to know what I know.
So I'm just going to give you guys a couple of minutes just to answer those questions, and then we'll then pick up our conversation again about this initiative. Because I'm hoping that what we can do is at least have something concrete so that then we can have next steps and maybe having another meeting just about this vaping initiative if need be.
Does this survey, the survey says CBT and CBD, but like it looks like you're saying cognitive behavioral therapy along with a bunch of drugs, or was that one supposed to be something else?
I disregard the CBT. CBT. I think I was trying to say CBD, Daniela, earlier. Baby brain.
Oh, okay. I wasn't sure.
Real.
I was like, I'll add it.
It's real. I don't even know my name half of the time. out of my conversation. And working from home. Who's over it already? I know, Ellen.
We're trying to, we've got some focus groups set up with youth in our town because we want to find out where they're buying vapes. I think, you know, I just want to say, I'm going to guess at what I think, but because there's not a, I don't know yet answer, but, you know, I think they probably are buying stuff online as well, but that's not something we can target, obviously, so.
Okay, so now is that the next step is focusing on our youth and getting maybe 1 or 2 focus groups together?
You mean for this initiative?
Yes.
I would say, like from my perspective, of course, I think a lot of us probably want to have youth focus groups for many purposes, so it doesn't hurt. But I also think that this campaign, you know, when Kathy was talking about it, and when we've talked about it previously, in my mind, it's almost more of like an awareness thing than anything else, because I think kids are probably not buying stuff at like Walgreens too much. I think they're probably going to like, you know, vape shops and gas station type places. And you can't, I don't think a campaign would be super effective trying to target like little mom and pop, you know, convenience stores attached to gas stations, because it's a big moneymaker for them and they're not all connected. But I think if we had like a region-wide campaign at someplace like Walgreens, you know, that would reduce access probably more for adults than teens, because I bet they're not selling a lot to the teens. But that would be really visible. I mean, it would definitely send a message. So in a way, I feel like, I guess I would support doing it with or without the focus groups on where the kids buying stuff, because I think it would just be a valuable thing to do and a very pretty easy thing to do to get like newspaper articles and raise awareness, and kids can make posters and people can write letters or however we want to do it. And it's just visible of going like, and I keep fixating on Walgreens because that's where I see the vapes most commonly. And Walgreens has a tagline that's something like about health. Like their tagline is something like at the intersection of health and Maine. So I'm like, oh, you know, and they can follow suit on CVS and we could just, that's my thought.
Mm-hmm. What are other people's thoughts?
Are you looking at doing like a regional thing? Is that what you're thinking?
Yes, all 14 towns agreed, or at least said that they were interested in doing something along that line of a regional initiative where all of us would be, you know, have the same type of material, information, and we would target potentially a supplier or a seller in each of our towns.
I think if you want kids to lead the work, it's going to be difficult because we have trouble getting kids to just meet locally. They're busy, and especially with all this hybrid learning and stuff. So I think you have to take that into account.
Gee, were you going to talk about the other regional initiative, the videos and the things that Kathy had also sent out? Oh, is that what that is? Okay, yes.
Yes,
thanks.
mention prevention. 2 separate initiatives though. I was hoping that for us at least, we would have our kind of similar to what mention prevention was doing, but of course our own way. Kathy was going to talk a little bit more about mention prevention because she was in those meetings. And I know that a couple of our towns worked with Milford and the alcohol campaign. And now they're doing a vaping campaign. So 2 different campaigns, and I just want to bring everyone aware to what mention prevention is if you don't know about it. And then if you'd like to be part of that campaign, to reach out to Milford, and you would be able to then work with them on that. But I'm really hoping that this vaping initiative, maybe it's something that maybe I can send out an email in a week to see what people's thoughts were after this meeting about this vaping initiative. I think that it will help us, especially since we all have to work on vaping, and this would be a nice initiative, whether it be, and I do like the letter campaign Margaret brought up, and having a letter and giving it to individuals where maybe we can make it a poster and they will be able to post it on their in their store about reminding people to check IDs, right? 21 and over now for young folks to vape or smoke cigarettes. So what is that? What is this initiative really going to look like?
That actually, Giovanna, sounds very similar to what we did with mention prevention for alcohol, because that campaign, the first piece of it was targeting licensees, because, you know, with the relaxation of all the alcohol rules, it became like the Wild West. You know, you could sell curbside, you could sell, you know, put alcohol in people's trunks, you know, so the first piece of mention prevention was a poster for that, that stores and restaurants could post for their staff, reminding them that it was still important to check ID, and that even with a mask, you still had an obligation to make sure you weren't selling to kids, in a very gentle way, because obviously we know that these businesses are struggling. And then the second piece of mention prevention was bag inserts, reminding adults not to, you know, to store their liquor, their alcohol appropriately. So that sounds, the vaping piece of mention prevention, which Kathy can talk about, because I don't think I've been in all the meetings she's been on, isn't targeting retailers in the same way for vaping. But I'm a little fuzzy. So when we talk about this Region 1 effort, we're looking at discouraging large chain stores from carrying the products at all, and then we're kind of not touching the mom and pops, because this is like their revenue stream. Is that, am I clear on that?
That's what Margaret was saying. The article, the initial article that Kathy sent over was the prevention professionals in Vermont really focused on getting a chain to stop selling vaping nicotine products. And the chain, which is what Kathy said is similar to a Stop and Shop, stopped doing that after this effort that they had.
Well,
So,
I think in terms of that, that sounds like it's probably a reasonable publicity effort on our behalf to show that we're unified in, especially these, I think the pharmacies is a great example, since CVS has already done it. You know, if you're about health products, you know, that's an obvious, we can shame them a little bit. I'm not sure that's where kids are. I agree with Margaret. I don't know that kids are actually buying there, but in terms of showing us as a united region-wide group thinking about these issues, I think it's probably a pretty easy first step, and it doesn't cost anything, which is great.
Yeah, and that's the thing. We're all, you know, penny pinching right now, so it's not about the dollars. We're trying to do this without having money attached. But what is that? And I want to see what everybody is thinking about, or at least what you're hearing about, because the initiative should be something that everyone agrees upon, that they see within their own community, right? So is it that Walgreens, and are we going to send out a letter campaign to the CEO or to the headquarters of Walgreens and try to get them to go down that same route as CVS?
Yeah, just for clarification, initially this was not a vaping initiative. This was a tobacco.
Tobacco.
And so that's, you know, one way to approach this is, yeah, I think the pharmacies, if you've got a chain pharmacy in your community, I think that's a perfect target because they should be about wellness, right? But just thinking in terms of an awareness campaign to get youth engaged, I was thinking of just having our youth kind of scope out the Stop and Shop. We have, I believe, 3 grocery stores in Fairfield, a Stop and Shop, a ShopRite, and a Trader Joe's. And have the kids scope out. So what do you see when you go into those stores? You know, how much tobacco is available for sale? What type of tobacco products? So this is kind of an awareness education campaign for them. And then, you know, let's sort of collect some data as to what's the scope of the issue at these 3 stores, at these 3 stores in our community, and develop you know, a letter or, you know, find out who the manager is of that store and approach the manager and have a conversation, having the kids have the conversation with the manager to say, you know, we really don't want these products available in our community because they do nothing but make you sick and they're addictive and, you know, yada, 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 yada. So it was just a little thing that we could do, I think, pretty easily, and maybe even get, you know, the district manager, find out who the district manager is, because I know, you know, an individual store may not have a whole lot of control over making those sort of decisions, but maybe that can happen at a district level. I don't know. We can find out.
I like that idea too. So do we need to, I know I'm a person that needs to process things. So do we need to process and think about some ideas and maybe have another meeting just to discuss about vaping in this initiative?
Can I just chime in as I'm about to jump off this meeting this is its own topic, I think, kind of similar to what Terry's doing. We probably need to have a separate conversation because there's a bunch of other stuff on the agenda and I think it's worth it. I think you're right, Giovanna.
Okay. All righty. Kathy, can you just talk briefly about mention prevention? I know Melissa started to, and I don't know if everyone is aware of what this hashtag is.
So I'm not exactly sure who started it. I want to say it may have come out of the Southington-Torrington coalitions.
I think it came out of steps from Southington.
It actually started because Milford brought a bunch of coalitions together just to see how people were dealing with COVID. And one of our I have a restaurant owner on our coalition who had brought up this whole alcohol sales issue, and I mentioned it, and then it turned into 7 of us broke off, or 5 of us broke off and developed this campaign. So it's Southington, Stratford, Trumbull, Milford, and Durham Middlefield, maybe. So kind of more north a little bit. But the idea being that we design a campaign that anyone could put their logo on and adapt for their own community, but yet we were, you know, kind of economies of scale and saving money because we got a whole campaign for like $500, which was great. So we focused on alcohol for that one, and then we thought that went really well, and we liked working with each other. So we were like, oh, cool, we're all getting LPC money. Let's tackle vaping, and then opened it up a little more broadly. So that's kind of the backstory on where it came from. But we wanted a hashtag that had staying power and that we could adapt to all, you know, whatever our local priorities were. And we're working with a really fantastic marketing firm in Milford, where the head of the firm is actually on the coalition, and he's really passionate about substance abuse prevention. So that's the backstory.
Yeah, so Change Ahead Marketing is the name of the marketing firm. Glenn Laudenslager, I think is how you pronounce his last name, from Milford. And so because of the success with the underage, with the alcohol retail initiative, folks wanted to come together and do something around vaping. And I think ideally they would love to get as many coalitions to participate in a unified social marketing campaign, because that only makes the price less for everyone, right? So it's all about economies of scale and some uniformity in terms of messaging. So for the vaping, Glenn put together a couple of ideas. There was the idea of doing some videos, of both an animated video as well as a video with using real people, targeting parents, as well as materials to target youth. And so that's kind of it in a nutshell. And they've got, I guess there were different social posts being developed, as well as these guidebooks, which was another possibility to, providing concrete information about how parents can have those conversations with their kids about vaping. So as I heard, I mean, Fairfield, because we had allocated our LPC money, we chose not to participate. But I believe there were about 9 coalitions participating in this initiative. And if folks want to learn more, I would say probably Kelly Lepard, I'm not sure how you pronounce her last name, would probably be the best contact. Her email, and I can put it in the chat, is kelly.lepard@gmail.com. And I could probably find Glenn's email as well. But, I think the mention prevention, as Melissa was saying, is a tagline that that works for everybody. And no doubt that folks will be coming together. My guess is that we'll probably do something on marijuana, maybe down the road. So that's kind of it in a nutshell. So I'll put Kelly's.
And if anyone wants to use the alcohol campaign, that's still available if anyone's interested. So I can get you.
Really nice. It's nice materials.
Is that a campaign that folks will have to pay into?
Yeah, I think what happened, I think they're paying, you're paying Milford Prevention Coalition for that, but it's nominal.
It's $200.
That's what Fairfield paid for. And the alcohol campaign consisted of the posters that are really targeted to the employees of retailers to remind them to card. And then there are kind of these 4 by 8.5 cards, if you will, that get put into consumer bags to remind adults not to provide alcohol to minors and the risks of underage drinking. And don't forget those social host laws. So that's something that Fairfield is doing right now. And with the holidays coming up, this would actually be a great time to actually do that alcohol initiative.
It's been a fun campaign because we went into the businesses and took pictures and then promoted, we have a Let's Mention Prevention post for Facebook where we say, here we went to this restaurant and they've joined our efforts. And so you get to plug some restaurants who could probably use some plugging right now. It's been nice. I mean, I got to, it's been easy and I think productive.
Awesome. Okay. And Margaret put in the Milford LPC information if you wanted to reach out to them and look into their alcohol campaign a little bit more, okay? So last fiscal year, we did a lot of learn at lunches, and of course, pre-COVID, we had several folks come to Norwalk to there were various topics. We had, you know, the state entities come, T-Task, Wheeler Clinic, a problem gambling came, just so that everybody knew who everyone was. And now this year, because of COVID, we're going to take it to the online platform. And I'm just wondering, what are people thinking that they would like to learn a little bit more about? T-Task has been revamped. And as you saw in their email, in my email, they are doing something along the line of getting the school professionals to the table on how to do that. Kelly Lippard, who is the coordinator of STEPS in Southington, she has had great success in outreach with her school district, that they are very, very involved in her coalition. So she will be on that, in that training. So if you are able to attend, please sign up. It should be a really good training. I was told that it is going to be recorded. However, I don't know if we're going to get that link afterwards. They're still trying to figure out how are they going to roll that out. Tom Steen has been conducting a QPR in a substance use disorder training. It's correlating substance use disorder with suicide prevention. That is something that I've been working with him on, and hopefully we'll get that going in the next month or so. And that'll be our first lunch and learn, most likely. And then in the Survey Monkey, you guys just reported on other topics that you would like to discuss. In the topics that were in the survey, anything else that wasn't in there that you would like to learn more about? I know, unfortunately, because of COVID last year, we had a capacity building training for beginners and then advanced. Is that something that you guys would like me to coordinate to have in our area, or at least to offer to us? I know many of you are CACA designees now, so you got all the good training. Look at Margaret, I can't stand you.
Well, I was just thinking, one thing I want to mention in terms of training opportunities, because I haven't even gotten the flyer out yet, but we're going to have Triangle Community Center do 2 trainings on LGBTQ, you know, interacting with the LGBTQ cultural, whatever. I don't like the term cultural competence, right? Like, so yes. They're going to do a 101 and a 201 level for us. And rather than do it in like just for our LPCs, we're going to do it through Positive Directions and just kind of open it up. And so I don't even have the dates in front of me to tell you guys, but that's coming up as an option. But also it's not like massively expensive if that's something a group wanted to bring in, because I think they're going to be limited to 25 people.
Is that going to be for kids, Margaret?
No, it's for adults. Yeah.
Okay.
But Anna Burns is their community educator who's been there since last year, and she has like a lot of different versions of it that she can do in different trainings, Carrie. So I think she probably could do stuff for kids.
Margaret, you're offering. Margaret, you're offering that training to everyone, right?
I think so. Well, I know we're offering it to the 3 towns we're working in, and then I would say we'd probably go first priority to those towns, and then if that doesn't fill up, then open it up to others. One thing Anna said is the 201 training, she doesn't want anyone to sort of say, oh, I've already done something, so I'm going straight to 201. She wants you to go to 101 before you go to 201. First training's an hour and a half, second one's an hour.
Okay. Please let me know if you see that there was a huge response on the training. If anything, then I could coordinate one for the whole region then.
Exactly.
And then be able to offer it to all of the towns.
Mm-hmm.
Any other topics at hand that folks would like me to coordinate? Substances, CBD, anything like that?
I feel like CBD would be helpful. Like CBD, kratom keep popping up as things that like, I feel like that we're going to have to get more familiar with and know more about and roll out more. But I don't know that any towns or groups of parents are like dying to have one more thing to worry about right now, but maybe we can all be educated about that stuff and be ready for when they're ready.
We surveyed our coalition last month on topics that the coalition members wanted, and CBD ranked #1.
Okay.
In New Canaan, there's a CBD store that opened up right in our town. So I think that would be great to, be informed about that and share that. Because I don't know that people really understand everything that, it entails and what,
Yeah.
And I feel like everybody wants me to buy CBD products for my dogs, like it's everywhere. Just.
So.
Giovanna, at the CADCA mid-year and in the marijuana presentation that was delivered, there's like a whole set of slides on CBD that I can forward that to you. It might be a good resource for you.
Yeah. Most likely I'll probably have to do my own research and create a PowerPoint if I can't find somebody that is willing to go over that. Thank you. So just to tell you about the CBD oil for animals. So my dog Maya, who's a bulldog, she has some hip issues sometimes, and the pet store that we go to is not your typical chain. And the gentleman said, oh, try this. It's for for her joints and things like that. And there was CBD in it. And I was like, I don't know about that. I don't even want to take CBD for myself. Never mind my first child here, So so he convinced me to try it. And it was 2 pumps in the morning and 2 pumps in the evening time, because she gets it fed twice. In the morning time, my poor animal, oh my God, she slept all day. There was a huge difference in her personality and energy that I did not like, and I discontinued that very quickly. I went from 2 pumps to 1 pump, and I still saw she just looked cloudy, and it just didn't work out. So I tell everybody that story because if you are in tune with your animal, you'll know exactly what's happening, and that CBD just did not agree with her. She didn't do well on it. So don't give your dog CBD. So if you do have any other topics, and if your coalition, if you did a survey with your coalition and found that there was a topic that people wanted to know about, please let me know, because I can do it as a regional. And if it costs money, I have dollars in my budget currently that I can pay for a trainer to do the training. So that's just a way that I can at least assist you guys in the work that you are doing, okay?
I just want to mention something that when Melissa mentioned the Mid-Year Training Institute, I know there are a bunch of people from Norwalk who attended, and everyone loved Dr. Berta Madras's presentation on marijuana, which unfortunately CADCA, I think, has now taken down, right? Like they don't make these things permanently
No,
available.
they're still up.
Oh, I thought they said end of September.
Well, I accessed yesterday.
Oh, that's
So
good to know.
they're still
But
up.
so if others are able to see it, like I would say, look for anything that Dr. Berta Madras, Madras, does on marijuana. She had a number of presentations, but she had one like keynote speech that was really 20 minutes. And I was just like, we could just show this literally anywhere to anyone. So look for her stuff on YouTube if you can find it. But one thing that she is doing consistently that I think is worth highlighting is she just only uses the phrase, the new marijuana. And it's not like new, we know, but it's just to constantly like raise awareness in other people and the people who don't know how different marijuana is from when they were in college. She's just like, she just keeps saying the new marijuana, the new marijuana. And I think all of us were like, yeah, we should all do that. Like we should just always say the new marijuana, because then people are like, what do you mean? And it's an opportunity. So I wanted to highlight that phrase.
That's yeah.
And the other phrase I learned about related to marijuana during mid-year, and I've been asking people, a lot of people didn't know about scromiting. You guys all know what scromiting is? So scromiting is this thing that's happening to people who are having a severe reaction to a high level of THC in their system, and it's uncontrollable simultaneous screaming and vomiting. And they've named it scromiting, screaming and vomiting at the same time from all the THC in your system. And I heard about it at mid-year, and then I started hearing about it from like providers and people working in the hospitals. And they're like, oh yeah, we have people coming in the ED with that. So I feel like that would be, if I were a teen, even with my like teen brain of nothing can harm me, I don't think I might laugh at that, but I would not want that to happen to me.
No. Correct. The state opioid response mini grant has ended. Those demographic forms should have been submitted to us. I know a couple of you have sent me an email with that information, so thank you. We did receive notice that we have another year of SOAR, and those mini grants will be coming out hopefully sooner than later, and you'll have a longer period of time to work on those deliverables. The hub received 700 Narcan kits this past month, or at least in September, I should say. So we do have Narcan available to everyone. What are people doing with Narcan training? Are you training in your towns? Are you virtual? Are you doing in person?
Greenwich did 2 online. We partnered with Ingrid, so we did make it sort of regional to the Greenwich Stamford area. We tried to target people in recovery because we had a good response when I did that in New Canaan in the past. And we still tend to get a lot of providers who are coming on to be trained, but that's fine too. But we did do 2 virtual, but at the last coalition meeting, the police chief and some others on the coalition were kind of pushing for trying to get back to in-person, just for the anonymity for people, that they don't have to sign up online or go on Zoom or whatever. So.
We offered an in-person one in August. We targeted college kids, and we did an alcohol and drug overdose with a little bit of QPR. Margaret helped us with that. Unfortunately, it was scheduled for the night of the storm. So by the time we could, because that's 2020. But by the time we rescheduled it, we had a bunch of college kids signed up, and they had all gone back to school. So we had a pretty low turnout, but I think it worked. I think it worked well to do a little bit of like, kind of help yourself, help your friends. I mean, it was, and it was completely delivered by young people. So we had young people from Turning Point, and we had a young EMT volunteer who did it as well. So that was kind of cool to sit back and watch them. They were great.
Oh, wonderful. So if anyone is doing training, please let me know. We do have kits. I will myself or someone else, Daniela or Sheila from Prevention Corps will deliver those kits to you all. I know for us, what we've been doing is eventually, once I get my act together, I will have 2 Narcan trainings a month, as well as one QPR training a month as well, every month for now. But that is in the works. But in the meantime, what I have been doing, anyone that has been reaching out to me asking for a training, if I don't know if you guys are doing anything, then I just send them to our YouTube channel and I have them watch our video. They sign a contract, not a contract, but just a form that just says that they watch the video and they understand how to administer Narcan, and I give them the Nora resources. Once they sign that, then I then give them a kit. So that's what I have been doing in the meantime. This is not something that I prefer to be long-term, but for right now, those that have reached out to me, they are looking for a kit immediately. I have been also giving out Narcan kits to our fire departments, our police departments, and EMS folks. So if you do know within your coalition membership, if they are struggling to purchase Narcan kits, let them know they can stop doing that and just reach out to me, and I'll be able to provide them with however many kits. As long as I get a roster in return, they will receive however many. I've given up to, I think, 100 kits to one police department at one time.
Giovanna, will your trainings be virtual?
Yes. For now, I will do those. I'm working with Prevention Corps to see if they're going to do in person, because I do have, eventually, I will have an AmeriCorps member.
Okay, will you be sending out information?
Yeah, oh yes.
Okay, perfect, thank you.
Once that gets organized, I definitely will send it out to all of you. Just to clarify about the shelf life, the 36 months, I sent out one email and then I had to send out another email because Demas updated that information to us. So now the new Narcan, the Adapt Narcan that we receive, will have a shelf life of 36 months, okay? Any other Narcan product will not. So some of the EMS folks and police departments, they don't use Adapt. They use another manufacturer. So if they are using somebody else, that shelf life doesn't pertain to them, okay? So it only pertains to the Adapt Narcan nasal sprays that we have given out to the community at large, okay? And that's 36 months. The Narcans that you all have, that whether they are still, they're not expired, you can use those. The expired ones, you can get rid of them, but you can't extend the 36 shelf life, okay? 36-month shelf life. Right before Margaret left, I believe, and forgive me, I don't know too much about this, but I was asked to put this on our agenda. But yard signs, Turning Point CT purchased some yard signs that are related to the
Smart recovery groups.
Smart recovery groups, thank you. Smart recovery groups, and we now have them, and I am looking for folks to take them off my hands. So who would like these yard signs? I can give you up to 10 signs These signs, we would like them to be placed in areas of your town that are high traffic areas, town halls, your gazebo area, or I'm putting one in front of my house. You could put one in front of your house if you'd like to, but I do need to know which towns would like these signs. Margaret, I'm sure you have more detail than what I just gave.
Yeah, and are they here yet? Because I just actually ordered them like 2 weeks ago. They're supposed to arrive now.
They are
Okay.
here.
And so, guys, this is part of the, you know, on the agenda it says turningpointct.org. So it's just literally telling people there are support groups in the region and online, and it's referring them to turningpointct.org/smart, because that's sort of the page for the state for where all the smart recovery groups are in Connecticut. But then the double bonus is, you know, then people, like young people, will also find the Turning Point CT website. So we ordered 100, and the idea was to maybe get like 50 out now, and then, you know, they all disappear, so then another 50 later. But if you can put them near like places Giovanna was saying, or on and off ramps of highways, wherever people in your town see these. So what happens is, you know, we've had a lot of smart recovery groups in the region. We merged them all into a couple of online groups back in March. They've still been going online. People have been, the teen group is still the most successful, but they've been kind of, you know, like kids are dropping out, and older people, young adults haven't particularly been coming. And so right now there's a survey going around to providers and potential participants to see if they would rather start coming back to groups if they are in person but socially distanced, or, you know, otherwise, like if you want to go online, are you aware of them? Do you want different times and places, so that we could kind of refocus when and where they're happening? But one where, so that's part of that is me saying, like, if you know people who might be interested in the groups, tell me, be on the lookout. Like, they are still available. They're all just online right now. And there are smart recovery groups throughout the state that will eventually be back in local communities. But so the lawn signs are really just going to point people to a statewide webpage so that they can learn a lot more, regardless of whether a group is near them or for their age or online or not online. And yeah, you guys can help to get the word out.
I would just say, I think we should hold off on putting out yard signs until after the election. They're, you know, they'll disappear within, you know, as soon as people start taking down the election signs, they may take those down. So I really would say, I mean, I think I could take some in Greenwich, but I wouldn't take them now just because it's too crazy. So
not a problem. Can just let me know in the chat who would like to take the yard signs, because then I will get those out to you. We will bring them to you.
And
okay.
Obviously I'm connecting with Maury anyway to get them, and for some of the communities. And Genevieve looks like she hopped off, but my past experience with Wilton is the town takes down anything that you put up instantly.
Oh, nice. Great. Okay. Just put out everyone that would like signs. I'm thinking I can give you up to 7 to 10, depending. So let me know how many signs you would like as well. Okay. I'm just putting up the awareness months and days that are coming up. We are in Wellness Month right now. Unfortunately, I haven't been doing much with Wellness Month. And of course, it's the timing of me coming back and dealing with a lot of other things that were just added on my plate. But I'm just wondering, what are people doing for Wellness Month? Anything specific with checkup, get your checkup from the neck up?
NCC just did Fresh Check Day this week. And also NCC is doing a virtual checkup from your neck up next week. So like there's like this week was more of the awareness wellness side of it, and next week is the actual online. The screenings are going to be online. Otherwise, just social media.
How are they tracking those that screen middle to high.
So I was on an initial call about it, and I don't know exactly what the final decisions were, but I mean, there's like identified counselors who are going to be available and kids are going to sign up for appointments. So, and Positive Directions is providing a counselor. And so there are just times throughout the day. So it's more of like the referrals are kind of from Fresh Check Day, and then people also have the option to sign themselves up, and then the counselors will just use the integrated behavioral health screening tool from the hub, and do the whole referral to treatment, and then report back to Wendy Mendez and kind of say this is what happened. So
is it possible that we can get that data information after?
Should be able to. Yeah, there's NCC is having that CART meeting on Tuesday, and I think the Fresh Check thing is Thursday. I mean, the screening thing is Thursday, so the final details are 2 days beforehand. So I'll make sure about that.
Okay. And, Daniela will be attending that meeting too, so she can ask them for that data. Anybody else doing anything?
I've seen some social media going around about it.
I was just going to say social media, for those that follow us, I hope everyone follows us on Instagram, Facebook, and Twitter. We also have a LinkedIn account, but we're not that active on that. But I don't know if you're noticing, we're posting a lot more. And a lot of it has to do with Wellness Month and Wellness Month, but then also Drug Take Back Day are a lot of our posts that we're doing right now. We did hire a marketing person to assist me in, or I assist her because I don't do it, but in the newsletter that we have been creating, and then the social media posts. So if you haven't, is everybody receiving our newsletter? Okay. If there's at any point in time, if there's something that you'd like me to add into that newsletter for whatever reason, please let me know. What I am trying to do is incorporate events in that newsletter so that everyone sees it. Over 2,000 people receive this newsletter, just so you know. So we are trying to bring awareness to everyone's town and what everyone is doing. Okay, so
Donna, when do you send that out?
We send it out every Wednesday. Sorry, you're muted.
I thought I kept myself off of mute. So if you send it out every Wednesday, when's the best time to get it to you? When would you like it by? That Monday before, the weekend, just to keep you organized?
I send her emails up to Tuesday afternoon, evening.
Okay. Okay. Thank you.
Yeah, you're welcome.
Giovanna, do we send everything to you or to her directly, or
send it to me?
Info? No, should we be using info at the Hub CT anymore? For the calendar?
For the calendar purposes, yes. So anytime anytime you'd like us to, excuse me, if you like us to add your event to our calendar, yes, you want to send us an invite or send your PDF of the flyer so that we can put it onto the calendar. I am managing that as well for now. So yeah. But the easiest way to do that is if you are putting it into your calendar, you can add us to that calendar invite, and then it will automatically be put onto our calendar. So if you add info@thehubct.org, you'll be able to do that, which then takes away multiple steps for me. Drug Take Back Day. I do know Stamford, Easton, and Fairfield are having actual events. Anybody else doing an actual event?
Trumbull is.
Trumbull? Is there a flyer put out yet?
It's on our social media.
Okay. I just haven't come across it yet. I must have missed it some way.
Yeah, no, I
somehow.
think we just put it up this week.
Okay, that will definitely be in our next newsletter. Anybody else?
New Canaan is doing it as well.
And your flyer? Is there a flyer?
I haven't received one. The police department is doing it, so they have drop boxes. They're at the police department.
Okay, I will just double check if there's a flyer. If not, I will mention it in the newsletter.
Yeah, so it says prescription drugs can be deposited at Walgreens, which is 36 Pine Street, for secure destruction on September 26th from 10 to 2, free and anonymous. And there's also a drop box located in the New Canaan Police Department.
Wonderful.
24/7.
Anybody else? And really just to adjourn our meeting, I think I'm right on time. Isn't that something? Our next meeting, please take note, is January 8th from 11:30 to 1:30. If you have any specific topics that you'd like to go over from now to then, please let me know. I will add that onto our agenda.
Gee, can I just ask one thing before we end? Has anybody had to change the script van in their community? We're having it in Greenwich
Kathy,
tomorrow.
do you remember? I think.
So I'll let people know. I'll let people know how it is. They seem to have a lot of giveaways and a lot of great information. So
yes,
I'll take pictures.
they have a lot. The Connecticut Clearinghouse runs that van, and if you get Thomas, he's fantastic. I love Thomas. Thomas is great. They're on the van. There's a bunch of pamphlets. There's posters. There's tchotchkes. You name it. There is. That's what's supposed to be on the van. So I can't wait to hear what your experience is going to be with the van.
Great, thanks. And if anybody has,
Ellen, how are you guys?
Go ahead.
Oh, yeah. How are you using the van? Where are you going to have it, and in conjunction with what?
It's going to be at the farmer's market. So they won't let the van, I don't think, park within the market, but we'll set up a table right at the entrance to the farmer's market. And so Greenwich Together came up with these hand sanitizers that have our logo on them and some statistics around prescription drug use and that kind of misuse. And so we're giving those out at the entrance to the farmer's market. So I had the van coming with me to then give out some other information about safe medication disposal and things like that. So that's how we're using it.
Nice, because people will be there. I know
they were trying to
get the van down.
Yeah, apparently they start lining up for the farmer's market at 10 after 9 and it doesn't open till 9:30. So that's what I've heard. So we'll see.
Perfect.
Wow. Wonderful.
One other thing we're working on, TPUD's working with Kristen Dubé-Horton, who you may know her name from when she used to work in the region. She's now in Texas, but she's a public health consultant, and we're working on a training for our coalition on implicit bias.
Oh.
At implicit bias around age, gender, and race. So we're in the midst of kind of, Nina and I are working with her to flesh this out with the idea that she could build something that could be, and it's around implicit bias in prevention. And so it might be something that she can kind of offer to other coalitions, idea being something kind of broad.
Oh, I would love that, Melissa, if you, let us know how that goes, because that would be great.
Is she charging?
Sorry?
Does she charge?
Well, we're not sure yet. We're in the design we're kind of in the design phase. We're going to offer it out obviously after. It'll probably be like November, December, January, or December. Like we're going to offer it in like bite-sized chunks across probably 3 coalition meetings. Because that was the second training topic that my coalition members identified as something they were interested in. So we're trying not to get embroiled in politics.
Yeah.
And
if anybody has good recommendations for anybody who does training on vaping prevention, that's my coalition is interested in that. So
have you talked to Smoke Stoppers at St. Vincent's Hospital? Janelle Jesse, she's actually out on medical leave right now. She was in a very serious car accident at the end of August, but she'll be back to work at the end of this month. She spoke at our 9th grade forum last year, and she's going to be in our virtual forum this year, and she was great.
Okay.
And she does it for free. And it's their education programs. And then they also offer, they're one of the only, I don't know if this is still the case, but they were offering teen vaping cessation classes through St. Vincent's as well.
Yeah.
So she was great.
And so she would be good to do a workshop for coalition members?
I'm sure she would probably do, like they do, she does workshops for kids. She did our forum.
Oh, great.
There.
Okay.
Yeah, I can send you her email. I can put her email address in the chat, but just know that
great.
right now she's kind of out on medical leave. So
And that resource that Mark sent out to you from the intern, she compiled all of those resources, and Smoke Stoppers is in there.
Oh, great. Okay. Thank you.
New email addresses, so just make sure you have
okay,
the up to date, because mine bounced back to her when I emailed her. So I'll put what I've got in the chat right now.
Perfect.
Thank you.
Okay. Any other questions? Wonderful. Everyone, happy Friday. Enjoy the rest of your day. If no one else has anything to say or ask, then we can end our meeting.
Have a good weekend.
Thank you. You too. Bye, everyone. So great to
Bye.
see everyone.
Thank you so much.
See you soon.
Bye.
Bye. Now I can't end because I got to figure out how to save this chat.
Oh, it saves it automatically. When you save your recording, when you save the recording, you will end up with, it'll be in your C drive